Welcome to the New England Journal of Medicine at the 2024 American Heart Association Scientific Sessions. I'm Stephen Morrissey, Executive Managing Editor of the journal, and I'm with Eric Rubin, Editor-in-Chief, and Jane Leopold, Deputy Editor. We're talking about a Phase 1 study of AAV9.LAMP2B gene therapy in Danon disease. Jane, what is Danon disease and what is its cause?
Thanks, Steve. So Danon disease is a rare X-linked dominant disorder. It's characterized by severe hypertrophic cardiomyopathy with neuromuscular deficits and neurocognitive deficits. In male patients, they typically are diagnosed around the age of 12 to 13 years. And without cardiac transplant, they will end up having an early death. These events typically take place around the time they're 19 to 20 years old. In women, this is a little bit more heterogeneous. So female patients present with heart failure and death anywhere from the time they're adolescents until up around the age of 50 years old. Now, the disease is caused by a loss of function mutation in the lysosomal associated membrane protein 2, or the LAMP2 gene, and this is actually a mediator of autophagy. So when this becomes dysfunctional, you get accumulation of autophagic vacuoles, the myofibrillar disarray occurs, and you get fibrosis in the heart.
Eric, what was the intervention and how did it work?
So, Steve, these investigators studied the effects of an adenoviral-associated vector, AAV9, that carried the full-length LAMP2B gene and infused this agent to a total of 7 patients ranging in age from 11 to 21 years old. As is often the case in early-phase studies like this, different subjects received different doses of the study vector. Participants received immunosuppressives after infusion to help prevent an immune response to the virus. As a Phase 1 study, the primary outcomes were safety and toxicity, but other secondary outcomes were to look at the level of expression of the LAMP2B transgene in the myocardium and evaluate symptoms, cardiac structure, and function. Some participants had high-grade adverse events, including one case of thrombotic microangiopathy, and in 2 patients, exacerbation of their underlying skeletal myopathy while taking an immunosuppressive regimen that included corticosteroids. All were alive as of this report that covers a period from 24 to 54 months after receiving infusions. As for efficacy signals, one patient had progressive cardiomyopathy and required heart transplant. Others were shown to express LAMP2 protein on cardiac biopsy and had improvements or stabilization of several measures of cardiac structure and function.
Jane, this is a very early phase study in older individuals with Danon disease. How much more do we need to know to determine the efficacy of the intervention?
Well, I think we're just at the beginning of this story. We're seeing the effects of the intervention in a few patients. We will need to know many things about this, such as whether or not there's efficacy of the drug over the longer term. We'll need to know whether this should be given at a younger age or we can give this as patients get older. We'll also need to know the durability of any effects on the myocardium in particular.
Eric, we publish small early phase trials much less frequently than large randomized control trials. Why did the editors choose to publish a study like this one?
Well, Steve, as you know, we do publish early phase studies, many of them, like this one, gene therapy studies. At this point, when we evaluate a manuscript like this one, we're looking for something new we can learn. In this manuscript, we see rather efficient transduction of the myocardium and stabilization or improvement of cardiac structure and function, which just hasn't been shown in humans before. Because there are many genetic diseases of muscle that might benefit from an intervention like this, we felt that our readers might like to know about it, even though it isn't available. Perhaps this treatment and other related treatments will become more available, and physicians will have something to offer their patients with diseases that are currently untreatable.
Thank you, Eric, and thank you, Jane. This study is available at NEJM.org.